contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then apply a new set of pads to the bare skin.
Excessive water on a victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If the victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.